There's a lot of controversy surrounding contact tracing and if it's considered legal. Fox 5 legal analyst Wendy Patrick joins us now to explain. Wendy, good morning.
Good morning, Raul.
Well, is it legal? That's the big question. But what is contact tracing?
Well, had you asked me that 3 or 4 months ago, it would probably be hard to come up with a good definition. I would have said it's finding out who won that lottery in the,
Yeah,
at the
right.
7-Eleven in the last package. Let's contact that person. But now we know it has a far more ominous meaning. It has to do with figuring out who might have come into contact with somebody who's tested positive for COVID-19. Now, why do we want to do this? We want to do this to quarantine people. So all across the board, this is being met with resistance. We understand that we have to balance personal choice versus public safety, but there are a lot of people in a lot of jurisdictions that are pushing back on the privacy implications of asking, where have you been? What have you done? And who have you been with?
Is there something to that then?
Well, there is, and there have been some lawsuits filed already. But here is really the distinction between what the government or what health organizations can and can't do. It is one thing to say, well, we're going to collect information about who comes into a particular business. It's quite another to say we're going to share it with whoever asks for it. And it is that last piece that has led to a couple of high-profile lawsuits. One in Kansas.
Yeah, the one in Kansas, the one I wanted to talk to you about because was it dismissed? What happened there?
Well, what happened in a small Kansas community, and it was a county that had, count them, 5 COVID positive cases. So right away, you can see that maybe there were precautions taken that many residents felt were unnecessary. But a lawsuit was filed because the health organization basically was collecting the information and then sharing it with agencies that wanted to know. They then really dialed it back and said, okay, this information is collected, but we're going to require a warrant in order to be able to access the information if anybody wants it. So the federal lawsuit, which had previously been filed, was dismissed. But the fact that legal action was taken really was a model for other places that are saying, we don't like the idea that those kinds of measures are being taken here either. So it just highlights the fact that it's one thing to say, okay, you can know if I went to the grocery store. But how about the liquor store?
Right.
Coffee shop versus casinos, medical clinics. There are all sorts of things people do in the interest of keeping their private lives private.
You can talk about the concerns moving forward with something like this, but I'm thinking in terms of sharing it, you can't tell everybody, well, it's for scientific research, it's for scientific data so that we can get to something better and improvement. Some people aren't buying that. They're not giving up their privacy. They don't want people to know where they're going and what they're doing.
That's right, especially if it involves things that could potentially be embarrassing, like medical appointments, fertility clinics. You're seeing a divorce lawyer or a criminal defense attorney, all the kinds of things you don't intend to share with anybody, much less the government, much less for purposes of having somebody then track who else was there. So these are novel concerns. They have to be addressed, but they have to be done in a fashion that makes people comfortable that they're not giving up too much of their personal privacy.
Isn't there something to the point where maybe you don't have to get that specific? You were in a region, you were near a building, you were on a certain block and track and trace that way.
Well, no, because of the proximity that
you need to know the room and the people, yeah.
For having contracted the virus.
Wow.
And that is one of the arguments that's been made. Well, isn't it sufficient that I was sort of in this general area? But it wouldn't be, because you wouldn't need to contact trace unless you've been in that close proximity. Sure. By the way, the other side of this is contract tracing is becoming a hot new profession that a lot of people are applying for all across the nation. It's full-time, it's part-time, and even has benefits in some areas.
Oh, wow.
So it's here to stay. It's a good thing we're figuring out now how to do it legally, but also in a fashion that people are comfortable with.
But what happens next here?
Well, what happens next is we have to find the balance. We have to find the balance between personal choice and public safety.
Yeah.
We have to find where the Constitution intersects with the very real problem of the spread of the virus. It has to be contained. The country is opening up. So that is where we go next, is how can we find that balance? It's going to be jurisdiction by jurisdiction, depending on how many cases are where. And we're going to just have to get through it together. But we're watching cases like the one that was filed in Kansas to see how do we resolve, how do we balance litigation versus legislation so we don't all run into the courtroom, which aren't even open, by the way, right now. But how we can actually do this to keep people safe, but also keep their private lives private.
Quickly before you go, the contact tracing, these jobs, it's like a job interview. What does it entail? Are you sitting in front of a computer tracking cell phone movement, or are you physically walking around going places? What is the job?
It's a great question, and a lot of people are asking that. You can do it from home. It mainly involves phone calls. Phone calls telling people who have been in a certain area that there's been a positive test of somebody else who's been there. So it is that type of thing. Now, here's the downside. What does that mean? It means potentially quarantining. And nobody wants to do that. So remember that transparency is what tracing relies upon. So there can be no good contact tracing if there's no good transparency and people saying where they've been. So these are the problems that we're all going to have to work through together as people have to overcome their suspicion in the name of public safety, which we all want.
And you get that phone call, it's like, who, you're a telemarketer? I'm going to hang up on you. What are you asking me?
Most of us do anyway, right?
And
then
people,
the telephone?
And people getting the phone call won't even know that they were being traced to begin with, and then that Pandora's box,
that's another
can
problem,
of worms.
You're right.
Call it whatever you want. Wendy Patrick, what would we do without you?
Always a pleasure. Thanks for having me.
Thank you, Wendy.